Welcome to the Victory Education Lounge. I'm your host, and today we're diving into a fascinating and often overlooked health topic: gastroparesis, digestive issues from insulin resistance. This is part 88 of our ongoing series on metabolic health. Before we begin, please take a moment to like this video, subscribe to our channel, and share your thoughts or experiences in the comments below. Your engagement helps us reach more people with this vital information. Have you ever heard of gastroparesis? It's a condition that slows or stops the movement of food from your stomach to your small intestine. Often referred to as delayed gastric emptying, gastroparesis can be quite a nuisance, causing discomfort and, in some cases, more severe health implications. Gastroparesis is like a stubborn traffic cop, halting the usual flow of traffic, in this case food, from your stomach to your small intestine. It's like your stomach decides to take a prolonged lunch break, leaving food to sit, undigested. But what causes this sluggishness in your stomach? There are several culprits, but today we're zooming in on one in particular: insulin resistance. Now, insulin resistance is a bit like a communication breakdown. Normally, insulin is the key that lets glucose into your cells to provide energy. However, with insulin resistance, it's as if the cells have changed the locks. The insulin keys no longer work, leading to a buildup of glucose in the blood. Over time, persistently high blood sugar levels can cause damage to various parts of the body, including the vagus nerve, which controls the muscles of the stomach and small intestine. When this nerve is damaged, it can lead to gastroparesis. Understanding gastroparesis and its connection to insulin resistance is crucial. Why? Because it's not just about managing the symptoms. It's about getting to the root of the problem, addressing the insulin resistance and preventing further complications. Gastroparesis is more than just a traffic jam in your digestive system. It's a sign that something deeper is amiss, and it's a call to action. It's a call to understand, manage, and prevent. It's a call to take control of your health. So let's embark on this journey together. Let's delve deeper into the world of gastroparesis and insulin resistance. Let's uncover the strategies to manage it, the lifestyle changes that can prevent it, and the medical advancements that are helping those affected by it. Understanding gastroparesis and its connection to insulin resistance is the first step in managing and preventing it. And remember, every step you take towards understanding your health is a step towards empowering yourself to live a healthier, happier life. The first solution in our list is dietary modifications. This approach can significantly reduce symptoms and improve quality of life for those dealing with gastroparesis, but it does require significant lifestyle changes and may feel restrictive to some. For instance, take Sarah, a 45-year-old with insulin resistance. She switched to smaller, more frequent meals and avoided high-fat foods, which resulted in a 70% reduction in her gastroparesis symptoms within just 2 months. Quite an impressive turnaround, isn't it? However, it's important to keep in mind that dietary modifications aren't a one-size-fits-all solution. What works for Sarah may not work for everyone. It's crucial to work with a healthcare provider to tailor a plan that suits your body's needs and your lifestyle. Remember, dietary modifications require commitment, but the results can be significant. Next on our list, medical treatments. These are often a go-to solution for those suffering from gastroparesis linked to insulin resistance. The primary advantage is that they can provide quick relief and help manage severe symptoms. However, they are not without drawbacks. Potential side effects and the possibility that they may not address the root cause of the condition are worth considering. Let's take the case of John, a 52-year-old man. John experienced a 50% reduction in nausea and vomiting after starting on a medication called metoclopramide, which helps stomach muscles contract. This is a common medical treatment for gastroparesis, and for John, it provided significant relief. However, it's important to remember that everyone's body reacts differently to medications, and what works for one person may not work for another. As such, medical treatments should always be discussed and monitored by a healthcare professional. Medical treatments can provide quick relief, but always consult with a healthcare professional. Our third solution is blood sugar control. An essential part of managing gastroparesis, particularly when it's linked to insulin resistance, is keeping your blood sugar levels in check. This doesn't just help manage the symptoms, it also addresses the root cause. So how exactly does it work? By maintaining optimal blood sugar levels, you can prevent further nerve damage, slowing the progression of gastroparesis. Let's take an example. In a study involving 100 patients with insulin resistance-related gastroparesis, Those who kept their blood sugar levels optimal for 6 months experienced a 40% improvement in their gastric emptying rates. That's pretty impressive. However, it's important to remember that this approach requires dedication. Regular monitoring, dietary changes, and in some cases, medication might be necessary. Controlling blood sugar levels can be a game changer, but it requires consistency. Let's talk about stress management. You might be wondering, what does stress have to do with my stomach? Quite a bit, actually. Stress can exacerbate the symptoms of gastroparesis. It's like pouring fuel on a fire. The good news is that managing stress can help tame that fire. Meditation, yoga, deep breathing, or simply taking a walk in nature can all reduce stress levels, which in turn can ease symptoms of gastroparesis. Let's consider an example. Meet Maria. She's 38 and has been dealing with gastroparesis linked to insulin resistance. Maria decided to incorporate daily meditation into her routine. After 3 months, she found her gastroparesis symptoms decreased by 30%, particularly during stressful periods. This goes to show that while managing stress may not show immediate results, the long-term benefits to your overall health and well-being are worth it. Ever considered acupuncture for gastroparesis? This ancient Chinese practice, which involves inserting thin needles into specific points on the body, has been used for centuries to treat a wide range of health conditions, including digestive issues. Acupuncture is thought to stimulate the body's natural healing processes, and it may help alleviate some symptoms of gastroparesis, such as nausea, bloating, and early satiety. The beauty of acupuncture is that it may provide symptom relief without the side effects often associated with medications. Take, for example, a small study involving 30 gastroparesis patients. Those who received acupuncture twice a week for 8 weeks reported a 45% reduction in bloating and early satiety compared to the control group. However, it's important to note that the efficacy of acupuncture can vary greatly from person to person, and multiple sessions may be required to see significant benefits. So while acupuncture may provide relief, remember results can vary. Next, we have gastric electrical stimulation. This is an innovative treatment option involving a device similar to a pacemaker implanted into the abdomen. This device emits mild electrical pulses, helping to stimulate the muscles of the stomach and improve gastric emptying. The upside of gastric electrical stimulation is its potential for significant symptom relief, especially for those with severe gastroparesis. For some, it can be a game changer, allowing them to return to a more normal lifestyle. But as with any surgical procedure, there are risks. These include infection, device malfunction, or complications from surgery. So it's crucial to have a thorough discussion with your healthcare provider to weigh the pros and cons. Let's take the example of Tom, a 60-year-old gentleman with severe insulin resistance-related gastroparesis. Tom experienced an 80% reduction in vomiting episodes after the implantation of a gastric electrical stimulator. Gastric electrical stimulation can be a powerful tool, but it's not without its risks. Ever heard of probiotics and digestive enzymes? These are naturally occurring substances that can aid in digestion and overall gut health. Probiotics are beneficial bacteria that can help balance the gut microbiome, potentially improving digestion and reducing symptoms of gastroparesis. Digestive enzymes, on the other hand, assist in breaking down food, aiding in nutrient absorption, and potentially speeding up gastric emptying. A 12-week study of 50 gastroparesis patients found that those taking a specific strain of probiotics experienced a 35% improvement in gastric emptying time compared to a placebo group. However, it's important to remember that the effects can vary from person to person, and some probiotics and enzymes can interfere with medications. As with any new treatment, it's always best to consult with a healthcare professional before starting. Probiotics and digestive enzymes can be a natural way to manage gastroparesis, but always consult with a healthcare professional. Last but not least, physical therapy and exercise. Incorporating regular physical activity into your routine can play a pivotal role in managing gastroparesis linked to insulin resistance. Exercise can not only help to regulate blood sugar levels, but it can also stimulate the digestive system, aiding in the movement of food through the stomach. Let's consider a real-life example. Meet Lisa, a 50-year-old woman who struggled with gastroparesis symptoms as a result of her insulin resistance. Lisa decided to incorporate a 30-minute walk into her daily routine. Over the course of 6 months, she noticed a remarkable 60% decrease in her gastroparesis symptoms, particularly abdominal bloating and discomfort. In addition, her blood sugar levels became more stabilized, reducing the further risk of nerve damage. So don't underestimate the power of movement. Whether it's a brisk walk, gentle yoga, or a session with a physical therapist, physical therapy and exercise can improve your overall health and help manage gastroparesis. We've covered a lot today. Let's quickly recap. Gastroparesis, a condition characterized by delayed gastric emptying, can often be linked to insulin resistance. It's a complex issue, but various strategies can help manage and potentially prevent it. Dietary changes can significantly reduce symptoms, although they might feel restrictive. Medical treatments can provide quick relief, but they may not address the root cause and come with potential side effects. Controlling blood sugar levels can address the underlying cause and slow progression, but it requires consistent monitoring and lifestyle changes. Stress management techniques, such as meditation, can reduce symptom flare-ups and improve overall well-being. Acupuncture may provide symptom relief without medication side effects, but its efficacy can vary. Gastric electrical stimulation can provide significant symptom relief for severe cases, but it's an invasive procedure. Probiotics and digestive enzymes may improve digestion naturally, and physical therapy and exercise can promote gastric motility. Remember, managing and preventing gastroparesis is possible. It's all about finding what works best for you. In conclusion, gastroparesis related to insulin resistance is a serious condition, but it's not without hope. By understanding the connection and taking proactive steps, you can improve your digestive health and overall well-being. Thank you for joining us in the Victory Education Lounge. Don't forget to like, subscribe, and share your thoughts in the comments. Your experiences could help others on their health journey. Disclaimer: the information provided in this video is for educational and entertainment purposes only. It is not intended as medical advice. Any health-related decision should be discussed with a licensed physician or qualified healthcare professional.